Okay. Good morning, everyone. Okay, we'll continue on our book reading this morning, The Toyota Way to Service Excellence by Jeffrey K. Liker and Karen Ross. I'm in chapter 6, which says Micro Principle. Last week, we started from principle 8, which says building quality at each step. Building quality at each step. Luke told us how to identify problems, how to expose all the problems, how to contain it, how to improve on the problems, and also learn in the process of solving this problem. He also told us that you cannot fix all the problem at the same time. You have to fix them one by one if you're willing and if you want to build in quality or build in standard at every step you take. Today on page 214, we'll look at quality improvement at Henry Ford's Health System Diagnostic Lab. Quality improvement at Henry Ford's Health System Diagnostic Lab. So no hospital can run without a lab analyzing blood and tissue samples. Every doctor working on a serious case is dependent on the result of lab tests. Unfortunately, testing is often taken for granted, like breathing oxygen. As long as it is available, it is out of sight, out of mind. But when it does not function, it is a crisis, particularly if patient samples get mixed up and the wrong diagnosis is made. Dr. Richard Zabo, Chairman and Senior Vice President of Pathology and Laboratory Medicine at the Henry Ford Health System, decided that he had had enough. He was not satisfied with the quality of efficiency of his lab, and he was not satisfied with his own leadership style despite decades of management experiences. Moreover, he felt that he had let down Dr. W. Edwards Deming, who had influenced him years earlier about building in quality. Things had to change starting immediately. Dr. Zabo attended a course on lean management and he preached. He was hooked. He saw lean as a practical version of the philosophy Deming preached. He went to work on his lab immediately, first trying to lead it himself from the top down and then learning to engage leaders at all levels. It was a major professional and personal transformation for Dr. Zabo, and the results were spectacular, putting his lab into the limelight as a global benchmark of lean management in practice. The Henry Ford Labs in 2015 generated $600 million in revenue and employed about 750 of the 23,000 people working in the Henry Ford system. The lab serviced 6 acute care hospitals and 30 medical clinics. Lives literally depend on the laboratory system. In large part because of its world-class quality, the lab in Detroit, southeast Michigan, has been steadily growing, taking on testing for the majority of Michigan, extending its services to the clinic and healthcare providers outside the Henry Ford system. The quality is the result of the decades of both developing a culture of people who are seeking perfection and building systems to dictate and eliminate defects. With over 11 million lab tests per year, the lab depends on the data analysis to identify common problems to attack. A new defect management system was initially based on human dictation of non-conformancy. This was eventually supplemented by specimen deviation data from the Henry Ford Health System's Laboratory Information System called SunQuest. The computer system collects data in real time as tests are being conducted and flags the defects immediately when they are discovered. This is like an automated version of the Ando system of Toyota. Zabo decided to go after the top quality certifications for labs, iOS 15189. The deviation management system was required for the challenging ISO quality accreditation, but Zabo thought the system was already quite good. However, through working on the certification and setting up the SunQuest system, Zabo discovered it was not as good as he originally thought. The team began tracking defects with 36 generic types selected from a menu. Zabo and the members of his group quickly concluded the generic menu was not effective and they needed more specific classification. The other category was filing up. They looked at the most frequent defect classes and where they originated, e.g., from a provider group like hematology or from their own processes. They eventually developed 125 types. They were ready to deploy the deviation management system and began by rolling it out to the anatomical pathology department, but it was not well received. There were many defect classification codes that were foreign to the pathologists, and as a result, they did not feel comfortable using the system. With the decades of lean management, the laboratory culture was open to input from all, and Dr. Zabo was not going to impose an overly complex system onto the pathologists. He learned the hard way the harm caused by his type of coercive bureaucracy. To tailor the system to the pathologists, Zabo and the members of his group decided to survey the pathologists to identify the most frequent defects. Zabo and his group developed a list of the 30 most common defects ranked by severity. Ultimately, the number was reduced to 7 of the most frequent and serious defects. The anatomical pathologists wanted a paper copy listing the defects so they could document where they thought a defect came from. In response, Zabo's group designed a one-page form for the pathologists, but when they saw it, they said it was still too complex, and in the past, they only needed 1/2 page. Okay, so this is where we'll stop for our reading this morning, talking about quality improvement at Henry Ford Health System Diagnostic Lab. And what did they do? They followed the Ando step that was required for quick step to solve or identify any problem that they might be having, which is 1, to expose all problem, contain it, then follow the plan, do, and correct acts to improve learning, then fix problem one by one. So at Henry Ford, to improve their healthcare system diagnosis, they had to identify the problems that they were having. They had to identify where these defects were coming from, most especially from the pathologists, anatomical pathologists, where they had enough and where they had much of the problem. He designed a system that was certified to work for them, just like the Ando system where a red flag had to come up if things were wrong, but it was not working for the pathological department. So at the pathological department, which is just the last paragraph which we read, they were trying to identify those defects so they will be able to solve their problem. So identifying problem, I'm containing the problem, I'm looking for solutions to this problem is another way where how we can improve in quality. Now the story today is telling us about improving quality in the health care system. So in every organization, in every company, in every department, improving quality is very, very important, just as we've learned today. So it is very important to escalate or identify any defect or problem you might be having at the initial stage. So this is your stop for our reading this morning. Thank you.